Alrighty, so here is part two of the week one PowerPoint review, either for your quiz or just for just a refresher on the concepts, the key concepts we talked about. So we went over and discussed in the first one just the intro to our therapeutic interventions, some of the things that we'll be going over for the remainder of the course, specific physical agents. The big takeaways were the stages of healing, the cardinal signs of inflammation, a few of why we use physical agents, the rationale behind use of physical agents, stuff like that. So review that. Then we're moving on to our first practical implementation of physical agent or a modality that's commonly used in physical therapy, which is known as soft tissue mobilization. In massage, they call it massage. We call it soft tissue mobilization. So here's our objectives, more objectives. We discussed in great detail draping for specific patients. That was good. Good to know the goals for proper draping, why we do draping the way we do. This is a breakdown of each one. Not specific to your quiz, but also always good to know. We spent a lot of time talking about this, so just bring your attention back to it. It's just meeting that person's needs, understanding that everybody potentially is not going to. There are things that you may not see on a medical history in terms of people's experience, which could be traumatic. So you always have to be the respectful practitioner and sensitive to people's experiences. Not only that, but that includes cultural experiences, possible, previous trauma, respectful boundaries for really and truly any of their prerogatives, and let them have autonomy within the treatment and know that they're in control. Okay, covering the patient. So these are a couple different ways we can go about covering or draping the patient. And again, these are going to be fairly quick. We spent a lot of time in lecture, so you should be well versed in each one of these. This is just a quick review. So if I breeze over some stuff, go back to your PowerPoint and make sure you look a little bit more in depth if you're having confusion anywhere. So position patienting may be the first therapeutic intervention you can provide. Always good to start with positioning to make your job easier and also maximize comfort for the patient. Good to know. I want you to have an understanding of the physiological effects of soft tissue massage. I'm not going to go through them here, but just realize you're going to have physiological effects on a number of different levels. Here's reflexive and mechanical. For instance, result of forces can help to change the mechanical nature, the histological makeup of the myofascial structures with direct force. So know these in terms of their effectiveness from soft tissue massage, and then understand some of the basic purported benefits that we get from soft tissue massage on these bodily systems. So just take a look at things like stimulating sensory receptors in the skin, increasing superficial circulation. This is specific to the integumentary system, circulatory system, increase local circulation. So be able to give me a good breakdown of ways that soft tissue massage can implement the physiological effects on these specific systems, skeletal system, connective nervous system. Just have a good understanding of these. Here's some others: mental clarity, feelings, well-being. Just, again, having a good, well-rounded working understanding of how that's all going to influence the patients anatomically and physiologically is enough potentially for this. Let's see. Do no harm. It's just a concept. So if you find yourself in a situation where you feel as though you're potentially making things worse, you can always stop what you're doing and cease the treatment immediately. So that's all. That's rule number one. We're never trying to hurt people. Endangerment sites. So not only do we have to know how soft tissue massage is going to affect the patient physiologically, we also need to know anatomically where we should pay special attention. So please know these endangerment sites. Understand where in the body they are, generally, like the area of the neck, anterior neck, in and around the anterior neck, and know what vulnerable structures are in that area that make it such a consideration why we have to pay so much attention. So axillary area into the armpit, in the elbow, you got the ulnar nerve there, umbilicus area, abdominal aorta, etc. So have a good understanding of these, obviously in and around the eye. The next thing that once we have our endangerment areas cited, and understand that anatomically there are places that we're not going to want to put too much pressure. We have to understand generally contraindications and conditions requiring caution for not just soft tissue massage, but also all of the modalities we're going to talk about moving forward. So, contraindication can be general or regional, just depends. Conditions requiring caution. So, the way you're going to hear me say it is a bit different from this. When I consider a contraindication, I'm going to think in terms of absolute contraindications, right? These are reasons, either generally or regionally, that we will not do this modality, okay? Sometimes you'll hear those used interchangeably, contraindications and cautions. Contraindications, sometimes you'll see sort of, in my view, wrongly said or stated as precautions. So a contraindication is by its very nature a reason why we would not do this to a patient. So it's, in my mind, absolute. Conditions requiring caution, or known as precautions, state that we can potentially engage in this modality for a patient, but we have to pay special attention to making sure that we are monitoring the patient closely enough to be aware of adverse responses. So if I have like low blood pressure, for instance, you're going to have patients who have low blood pressure. That does put them at an increased risk of fainting. However, it doesn't necessarily mean I can't do soft tissue massage on it. It just means that perhaps I want to use some of my test and measures, my vital sign readings, to make sure and actively monitor that patient to prevent this from going from a precaution to a contraindication. So that's how you'll see it. Again, contact lenses, can I not do massage on a patient with contact lenses? Of course I can. I just might need to be patient aware or very careful for certain patients when conducting soft tissue massage in certain areas. So here are the table and the body mechanics, right? Know these. This is more of a lab thing. And what we want to make sure that you have is we're going to learn the fundamental strokes for massage or soft tissue mobilization. The first being effleurage, and the massage will always begin and usually end with effleurage, but it's always going to be the opening and closing stroke. These are the basic soft tissue massage strokes. You should know these and how they present, the ways that we perform these. So effleurage, petrissage, friction, tapotement, vibration. Make sure that you know each one of these, how they're conducted, and potentially the types of, or the breakdown subcategories of stroke implementation that you can use, right? So effleurage, you could have a two-handed effleurage, single-handed. We could do the tree. You could do things like the shingling, right? These are all effleurage strokes because they're unbroken glided movements following the patient's body. So understand the basic tenets of effleurage, know the tenets of petrissage, as well as their purpose, right? So why are we doing this? How do we do petrissage? Well, it's a kneading, sort of a lifting, squeezing, release of the tissue. And why are we doing that specific stroke for our patient, right? So know these, understand the same thing for friction and the purpose behind it, as well as tapotement and vibration. And then we're going back to effleurage. Okay. One thing to know about myofascial release. With myofascial release, the key understand here is it's a treatment approach that's going to focus on the myofascial system and unwinding of the fascial tissue. So focuses on the myofascial system and unwinding that fascial tissue located in the fascial system itself. So we got different stages. You guys can do a lot of continuing ed and myofascial release, but this is the key part, myofascial system. Right. Instrument-assisted soft tissue massage. Again, these just know what it is, how it's conducted. Things that you can see, like these pinpoint-sized spots of bleeding under the skin that gives you that purplish red brown dot. They're not raised. It's not a rash. It's not ishy, right? So understanding, like, it shouldn't look like this, right? So a basic working knowledge of instrument-assisted soft tissue massage, sometimes called Graston. Dry needling as well. This is not something we'll do as LPTAs, but a working knowledge of why it's used, typically performed for the release of trigger points in many cases. Self-mobilization techniques, just no variation. And then how we would document. So certainly for any of the ones that we're going to cover here moving forward, documentation is going to be key. So points of consideration for your documentation for soft tissue massage: what position was the patient in? What kind of soft tissue massage did we do? Right? What were the strokes? How long was the treatment? What structures did you treat? Well, we worked on the trap for 15 minutes and I did some petrissage and trigger point release. And then the patient tolerance to the treatment. So know these. And outside of that, that's pretty much the focus for that particular PowerPoint, specifically when it comes to your quiz moving forward. Cool. Hopefully that was helpful.